Wagdy from Egypt, presenting a very exciting topic on wireless electrostimulation.
Thank you, Dr. Ayman. My topic today is about wireless electrostimulation in wound care management. Firstly, we need to understand what about the bioelectric principles of wound healing and explain the mechanism of electrostimulation. And we have two types of electrostimulation, conventional type and wireless type, and comparing between them. And finally, the evidence, current evidence, limitation, and the practical clinical considerations. Firstly, bioelectric nature of wound healing. Skin is an electrical organ, normally maintain what's called TEP, transepithelial potential difference, through ion transport across epithelium, sodium actively transported inward and chloride outward through tight junctions. This maintained voltage difference was about 10 to 60 millivoltage, so the skin behave like a biological battery. What happens if after injury? After injury, this TEP will collapse at the site of wound, and the surrounding intact epithelium is still polarized. And this will create what's called lateral electrical field toward the center. And this elevating the electrical field to 40 to 200 millivoltage per milli. And this what's called galvanotaxis. It is many cells will react to electrical signals. Keratinocytes, fibroblasts will towards the cathodes, neutrophils, macrophages towards the anodes. And this supports the reepithelialization and the shape orderly wound repair. What happened with cellular effects? There is also electrical stimulation, increasing vascular endothelial growth factors, collagen deposition, and also antibacterial effect. What happens in chronic wounds? There is reduction or absence of this electrical field. So the role of wireless electrostimulation is to replace these lost signals by restoring electrical gradient, reinitiate galvanotaxis, and reactivate healing cascade. Cathodes attract keratinocytes, which promote reepithelializations, and those will attract macrophages, which reduce infections. What is wound electrostimulation? Wound electrostimulation is application of controlled electrical energy to the wound area in order to promote healing. We have two main types. The first type is conventional type, external device. There is wires, there is electrodes, this is a photo. Also, there is wireless electrostimulation, is dressing-based, no wires and no greenery. Okay. What about wireless electrostimulation? Because of time, mechanism of action, promote cell migrations, enhance fibroblast proliferation. The main role of wireless electrostimulation is adjuvant only. It is not replacement of standard wound care. Venous ulcer need compression, ischemic ulcer need revascularization, neuropathic ulcer need offloading. What about application? It is easily portable, suitable for home care, improve compliance, using in limited access to device-based therapy, and possible anti-biofilm effect. What about the evidence summary and the limitation? Let Dr. Ahmed Wagdy.
Thank you, Dr. Eslam. So about the broad electrical stimulation therapy, it has been like an effective method to accelerate healing in chronic and difficult wounds. Wireless systems represent an exciting advancement due to their potential role in disrupting biofilm. However, larger high-quality studies are still needed to confirm their quality to be balanced. While wireless systems are very promising, the strongest evidence currently still supports the traditional wired techniques. And here are some of the most recent studies, actually focusing in studies in diabetic foot and chronic wound ulcers. So the limitation of current evidence, we have like small sample sizes, we have different wound types. In conclusion, although early results are very promising, we still need larger, well-designed clinical trials to clearly establish efficiency. In conclusion, wireless electrical therapy is a valuable adjunct in wound management. It enhances healing and helps reduce bacterial burden, but it doesn't replace standard wound care. Thank you.
Thank you both very much.